So ACEs, Adverse Childhood Experiences and Resilience, Understanding and Moving Beyond Our Shared Trauma. Our next presenters will be speaking on a topic that many of us know, resilience. We will learn about ACEs, though this presentation focuses on understanding and moving beyond our shared trauma. We will be provided with information about the resilience movement for the Santa Barbara County Department of Social Services, and this is Barb Finch. She's the director there, and is a local champion and catalyst for launching Resilient Santa Barbara County, a cross-sector county-wide ACEs and Resilience network. Terri Allison was a co-founder and executive director of the Storyteller Children's Center. Terri is a co-founder and facilitator of Resilient Santa Barbara County. Please welcome Barb and Terri.
First off, thank you very much for sticking around for the end of a very long day. I just want to invite everyone to stand up. Your lunch is settled now, and, we need a little bit of movement, shake it out, wiggle your hips, get some energy, get some blood flowing. We're going to try and make this interesting. It has been such a wonderful day. So many fabulous programs that are there in our schools, making a big difference. And we're here to provide a little bit of a different insight. You can sit down when you're ready. You don't have to stay standing. We're going to provide a little bit of a different perspective on things, something that actually started in the healthcare field with a study that was done by Kaiser Permanente and the Centers for Disease Control. And it's made its way into the social services realm, and it's making its way into education as well. And so many of the themes that you've heard today are going to show up in our presentation, but with a little bit of a different spin. Nope, other way. So we had some goals for today. Basically, what we want to do is, for those of you who are not familiar with the ACEs study, we're going to give a brief overview of that. As you heard, probably many of you have heard of ACEs, yes, and are familiar with that study. But we want to talk about biology and use that lens to kind of understand how this collective trauma that we have all experienced in the last few years is not just with our students and their behaviors and their struggles showing up, and with the teachers, but it's all of us. We're in it together. And so if we understand it from our biology, then we find different ways to make a difference and move forward in healing, which is what we're all about. So we are going to share with you a little video from the number story.
Let's start here. The story of your number is the story of your ACE history, a score used to measure the number of adverse childhood experiences that happened to you before the age of 18. ACEs fall into 3 categories: abuse, neglect, and household challenges, and are so common that 2/3 of us have at least one. A landmark study found the higher the number, the more likely one can experience negative health effects like heart disease, diabetes, depression, stroke, and asthma. The number is connected to an increased probability of lots of bad stuff. But you are not a number. The number is simply an entry point to your own personal story. Where it leads is up to you. ACEs are not your fault. They happen to us, but they don't need to define us. No person with a 2 is the same as another person with a 2. Each 7 is different from every other 7. Each of us is a unique story, and we each have the power to determine how our own story turns out. Explore the story of your number. Understand how it impacts the children in your life, and take control of where your story leads.
So that's a fairly new website, numberstory.org. It has wonderful videos, resources, interviews, testimonials. It has healing tips for healing yourself, for healing your children, for working with your community. So if you haven't checked it out, we encourage you to do so. So the landmark ACEs study happened in the late 90s, 1995 to 97. The results were published in 1998. Dr. Vincent Felitti and Dr. Robert Ando were the co-principal investigators. And this study involved about 17,000 patients at Kaiser Permanente in San Diego. Mostly white, mostly educated, all with health insurance. And so kind of a unique sample when we think about the population as a whole, but what they found was that ACEs, they tested people, they asked people about their health history, and they also asked them about their childhood experiences. And it was really the most comprehensive study that linked childhood experiences such as abuse and neglect to long-term health outcomes. And so it was landmark in that sense that it linked these 10 specific adverse childhood experiences to higher risk for health outcomes, many of which have been mentioned here today. It was shocking at the time. The investigators really were surprised by the findings, but it led to additional research and the ACEs movement as we know it today. So what are adverse childhood experiences? There's basically 3 categories: abuse, neglect, and household challenges. And so when we think about abuse, it's physical abuse, sexual abuse, and emotional abuse. Neglect is emotional abuse, and emotional and physical neglect, sorry. Whew. And then the household challenges include things like having an incarcerated parent, substance abuse in the home, separation or divorce of parents, mental health issues, and substance abuse in the home. I'm going to pause here and breathe. Sorry, my nerves are getting the better of me. Okay, so those are the 10 ACE categories, and these have been well researched and linked to a higher incidence of negative health and behavioral health outcomes. So how prevalent are they? They found from this study that about 2/3 of people had at least one adverse childhood experience, and that if any one ACE was experienced, there was an 87% likelihood that there would be additional ACEs. As I mentioned earlier, the sample was primarily white, middle class, and college educated. And so subsequent research has shown that there's a higher ACE burden in certain communities, and that includes low-income communities, women, BIPOC, people who are Black, Indigenous, or people of color, and the LGBTQ+ community. All have higher ACE burdens. And so why is that, do you think? The key has to do with what we call the pair of ACEs. And so we talk about the adverse childhood experiences, and then the community, the environments, adverse community environments, also kind of feed the ACEs. So when you look at that list of 10 things, you probably think to yourself, well, that's not all the adversities that affect children and families. Those aren't the only things that are creating hardship for families in our community. Things like poverty and discrimination, housing and lack of food security, violence in the community. These things all create environments, and we can talk about those as the social determinants of health. They're things that make it more challenging to raise healthy kids and healthy families. And so when you have these adverse community environments, it gives rise to more stress, which leads sometimes to the adverse childhood experiences. And the reason why this is important for us is because ACEs are associated with increased behavioral health risks. So many of the things that have already been mentioned today are also linked to ACEs. So things like smoking, alcohol abuse, use of drugs, depression, risky sexual behavior, anxiety, many of the things that we're seeing increased prevalence of as during this COVID pandemic. But the ACEs are associated with some of these behavioral health risks. And if we think about the original study, it shows that as the number of ACEs increases, so does the risk for some of these mental health outcomes in adulthood. And so it's important to understand that although these are statistics that have to do with adults, we also know that children's behavior exhibits some of these same trends, and that when we're working with kids, it's important to understand the behavior rather than just focus on managing it. And so if you understand that some of the kids you're working with may be bringing some of these adversities into the classroom with them, then it makes it easier to have compassion and to try to understand what they might be dealing with in the home.
So, hi, I'm Terri, Allison. It's not all doom and gloom. And in fact, today we've talked about a lot of, I'm gonna need to, okay, there we go. I probably don't even need this. We've talked a lot about all the things that you can do, the, veggie IQ, the 100-mile walk, walking 100 miles a year. All of those things can really help to, deal with ACEs. And one of the things I want to talk about a little bit is the stress continuum. But before we get there, I just wanted to let you know that sometimes when we talk about this, and if you've experienced some of those if you've experienced it, it can be triggering, or if you're thinking about, like, what is my ACE burden? So earlier we talked about the employee assistance plans. But if you're feeling any kind of feelings as we start talking about this, please reach out to someone that you know, your employee assistance plan, because a lot of this can be really triggering. So I want to talk a little bit about the stress continuum. And am I going the right way, Barb? Okay. It's been a long day. So, so the stress continuum, not all stress is bad, right? The stress that I'm feeling here, talking to all of you, is making me a little more alert. And that can be positive stress, or when you have a test to take, that's positive stress. Moderate stress is when someone, if you have a sick relative, but you know it's going to end. And so that can be tolerable. But what we're talking about, and one of the reasons that the ACE burden is so difficult, is because it's that toxic stress. Day after day, you come home and you don't have enough to eat, or you come home and your parent is intoxicated. So that is what affects, that's what is one of the reasons for diabetes, is some of those toxic stress things that happen early in our life. And so what can we do about it? How can we, mitigate some of these stressors? So what I want to do is I want to talk a little bit about the mind-body connection and how our minds and our bodies, we have a list of resources in the packet. And one of the things is there's a book that's called The Body Knows Its Mind. So I want to do a little thing. So everybody pick up your foot, one foot, your right foot or your left foot, and start turning it clockwise. Okay, now make a 6 in the air. What's happening? So we don't always have control over our bodies. Our bodies are functioning along with our minds and affecting how we look at the world and what's happening with us. Like right now, my heart rate's elevated a little bit, right? But so one of the things that I want to talk about is this is a heuristic, this is a diagram of the brain. Very simply put, and I've been fortunate to do some training with Dr. Bruce Perry. And one of the things that we want to think about is the brain is organized from the bottom up. So your brain stem, my brain stem is, that's why I'm breathing. I'm not thinking about breathing. I'm going up into diencephalon. My heart rate's up. My limbic system is really heightened right now because I'm presenting to all of you. there's a doctor in the house, and I'm talking about the brain, all of those things, right? But what our highest functioning is going to be up there in the neocortex, right? We want to be in a place where we can think and reason. And so this is the very simple thing to be thinking about. This is the brain without all those words. And what I want you to think about is as we're thinking about going through our day, as we're reacting, as we're looking at each other and working together, is we need to be doing these things. We need to regulate. We've got stuff coming from the outside. We've got stuff coming in from the inside, so we regulate. Then we relate. Getting back into that middle part, the diencephalon and the limbic system is, how are you doing today? What's going on for you? And then we can get into that higher level thinking. And I want you to think about, as you're thinking about the families that you're working with, thinking about the children that you're working with, thinking about each other and the stress continuum that we've had and the things that we've been through, is this needs to be repeated over and over and over again. You regulate, take a deep breath, feel your feet on the floor. You relate. That's, things happen in our relationships. And then you can go to reason and relating. So what are some of the things that we can do? I've mentioned some of those to regulate, to get ourselves out of that toxic stress and to get us back into some homeostasis. Take a drink of water. Take a walk. Take a deep breath. All of those things, and to make sure that we're taking care of ourselves, because as Barb had mentioned, we've all had, one of the things that is interesting about learning about ACEs, it's helping us understand our behavior. When I was the director at Storyteller Children's Center, one of the things I learned really early on is, as teachers and as educators, we're taught to manage behavior, right? We're class management, all these things, but what we really want to do is we want to understand behavior. We want to understand why are we acting like this with each other? Why are our kids going off the deep end? Those of you that work with youth, it's really hard right now. And so to be thinking about, the ACE burden, the toxic stress that we've all been experiencing, and the trauma that we've been experiencing, and then to think of this, think of those things, and then think about regulate, relate, and then reason. So, and I think we're up to you, Barb. So we're going to be talking about some trauma-informed workforces.
So we talk about ACEs, and that's stuff that's happened in the past, things that happened to you as a child. And then we talk about trauma and wanting to be trauma-informed, to have trauma-informed classrooms, and to have trauma-informed approaches to the care we're giving, to have trauma-informed organizations. And so what's that link between ACEs and trauma? And the connection is that ACEs is an experience, and it doesn't tell you whether it happened once or continuously. It's just, did this or did this not happen to you when you were a child? And when we talk about trauma, trauma is not the event, it's the experience of the event. And so it's what happens in our bodies and in our brains when we come up against something that makes us feel unsafe, or that makes us feel hopeless or helpless, or are out of dysregulated, in a dysregulated state. And so not everyone who experiences ACEs experiences trauma. But we know that the prevalence of ACEs is high, and so it makes sense that there would be trauma in any given classroom. There are kids that are coming in with ACEs, there are kids that are coming in with trauma. In any given environment, there are also employees that are coming in with ACEs, that are coming in with trauma. I work for social services. We've just started doing an introduction to ACEs and trauma with our new employees. And so we've done it twice now, and in both cases, the original study had, I think 16% of the folks had 4 or more ACEs. And in my social services new employee groups, 40 to 50% of the people in the room have 4 or more ACEs. And so we know that people who've experienced adversity as children oftentimes are drawn to professions where they're giving back. And so we don't need to know anybody's number. Like the video said, your number doesn't define you. But if we understand that there are ACEs among us, and we understand our own trauma, our own triggers, our own experiences, and how that colors our view, then we can use some of those skills Terri was talking about to help ourselves regulate. Because if we're not regulated, we're not showing up for the kids in the way that we need to show up for the kids. And so that's kind of what we want to help people understand, is that regardless of the specific experiences or the specific traumas that are in your classroom, if you use trauma-informed approaches, you're going to be successful. And that starts with recognizing your own triggers. So what is the framework for trauma-informed care? It starts with understanding, right? Yeah, it's okay. I can't, like, my eyes don't let me see that. It's the, the reading glasses thing. It happens when we get older. Okay, so trauma-informed care is a framework that involves understanding, first of all, the prevalence of trauma and adversity in any given population, and the impacts that it has on children, on families, and on service providers. So there's a tendency to blame parents for kids' bad behavior, and so this is a way to understand that everybody's doing the best they can. And so rather than blame the parents for the child's behavior, ask ourselves, gee, I wonder what happened to them. I wonder what happened to that child this morning. I wonder what happened to that parent that makes it so challenging for them to show up in the way that I'm asking them to show up. So that curiosity. So it's understanding the impact, it's recognizing the effects of trauma and adversity on health and behavior, and many of the things that were talked about today, that's how trauma shows up. So we want to be sure that we're providing training, not just for our direct line staff, but for the people who are answering phones and greeting people in the office and seeing kids in the cafeteria. Everybody needs to understand their own trauma and the trauma that exists in the workplace and with the kids. We want to integrate knowledge about trauma into policies and into, the practices that we have in the classroom. We heard today about mindfulness. On the wellness walk, there was mindfulness activities happening out on the playground. We saw pictures of mindfulness activities in the Veggie IQ. So things like that, just integrating what we know works into what we do on a daily basis. And then probably most importantly, we want to resist re-traumatizing by approaching individuals who may have experienced ACEs or trauma in a way that's not going to re-traumatize them. So instead of scolding the parent for not showing up on time for their parent-teacher meeting, understanding that they may have a lot of things that they're trying to balance and it just wasn't possible for them to get there on time. So when we talk about trauma-informed care principles, these are based on the principles of trauma-informed care that came from the Substance Abuse and Mental Health Services Association. Physical and emotional safety. I love that Isabel modeled for us, how to create psychological safety, those little moments of, I hear you, I see you. That's really important in creating that psychological safety. Building trust between people, whether it's teacher to student, administrators to teachers, teachers to families. Trust is that foundation that's going to allow us to be successful. So it's really important to do what we say what we do, treat folks with respect, and create that trust. I want to recognize the signs and symptoms of trauma exposure on physical and mental health. Those wellness centers that we heard about this morning are places where students can go and regain their sense of safety and regain their sense of being centered. Promoting the student-centered interventions and evidence-based care, getting their input, what works, what helps, what do they want, what are they excited about. And that's part of the collaborative process too, making sure that we're talking to families, talking to students, talking to teachers, getting everyone's input about how to create those places where well-being is centered and where well-being is what we're cultivating. And then the last principle really is so important, to be mindful of students' racial, ethnic, and cultural background, and also gender identity. These things are really important when we consider trauma-informed care. So all of the activities that are supporting that will help us to function better as a school community.
So this is my favorite part. I'm going to ask you to reflect. Oops. If I can ever learn, it's going to be the end of the presentation, and I'm going to finally figure this out. I want you to take a minute and let's think about you know, all the information that you've heard today. Think about what we've just talked about, the you know, regulate, reflect, and or regulate, relate, and then reason and reflect. And just with your table mates, you know, your partners or your whole table, we're a small group now, think about some of the things that you might be doing and how is this information about stress in the brain going to inform your work? What are some things that you might change? So let's take a few minutes just to talk about that, and then I'd love to hear you report back out. Okay, I want to bring us back together. It's so nice to see you talking. The energy is a little bit different than it was this morning, but tell me some of the things that came up for you, and what are some things that you're thinking about from today?
I think it just raises a lot of emotion, right? Because it just, you know, being trauma-informed just can trigger things that you may not even be thinking about until you see it, either visually or auditorily, right? And so I think that sometimes not only for our students, but for our teachers as well, and for our families. So just really embracing that and reassuring that experience at the time, really helps support them with those
Yeah.
feelings.
Yeah, and it's so important to understand, right? To that understanding. I mean, I know that there have been, with my work with families, is a family learns this information, or we learn it for ourselves, and we go, you know, I'm not a psychopath. I get it. I understand what's happening. You know, and it gives us a little bit more understanding. And the one thing I do a lot of reflective practice groups, and one of the things that I was in this group with this young man, and he had gone to an ACEs training. Barb does this great Bridges to Resilience conference every year. And he just came into the group and he said, "Terri, I'm doomed. I'm an 8. I have 8. And I said, "Oh, no, buddy, you're not. Because look at you right here. You're here. You're looking at it. You're understanding it." So again, the number doesn't mean, the number is, it's an assessment, and it's not even a predictor of outcomes. It's understanding our own biology, understanding what's happening with us and our students. And then, like Barb said, is then having a trauma-informed, a trauma-responsive approach to how we respond. You know, with that family that comes to the conference late, you say, "Would you like some water?" Regulate. "I'm so happy you showed up." Relate. And then everybody's ready to talk about it. The teacher, the person who's there feels more grounded. The parent goes, "Phew, thanks." Just like, the speaker earlier today said, that's my aging, I can't remember her name, but she was great, is that I see you, I hear you, right? And so we need to have, grace with each other, but grace with ourselves as well. So thank you for bringing that in, because this information can be really triggering, right? Anything else? Yeah.
Can I ask you a slightly weird question? I hang out with a lot of engineers. I don't want to, but I seem to hang out with them. If I built a stressometer that a person wore, and so they could see real time their stress level, however it's measured, I'm wondering if that's something you think might be of value in certain individuals or situations, so that when your stressometer says you're in the green zone, then you're able and willing to learn. When it's in the red zone, you're going to have to do some of these strategies that you were thinking about.
Yeah, that's a great idea. And, I'm a big sports nut, so, athletes do that all the time. They get that brain training, and that's how, a pitcher can be facing, some big hitter and calm themselves down. But I do think that there's something, and one of the things I think that we can do too is to start to notice within ourselves, looking in within ourselves, and as you feel your heart rate go up, or as you feel those things, or you're knowing those things that trigger you, then you go, "Oh, there it is." And then you feel your feet on the floor. You take a deep breath. But I do think that there's something in that, and there's been actually some studies that have been done where they can, you would probably understand the science better than I, but where they actually can take the cortisol levels in saliva and then help people understand their own response to stress and things like that. But I do think that there's something to that, yeah, to be looking at that. I'm going to get us on a little bit more.
Hey, Terri,
and then-
can I just say something, Terri?
Sure.
So I love the idea of something you can wear that actually gives you that feedback, but there is something called the community resiliency model that's being taught in schools, especially in North County and around the county, and it teaches you about your resilient zone. And some people have a very large resilient zone where they can function with the ups and downs of life. Some people have a very narrow resilient zone. So just teaching people about the resilient zone,
Well, and yeah. Uh-huh. Yeah, yeah.
Thank you.
And, pretty soon, if the watch can tell when you're in a car accident, you could probably use your watch to help you do those things as well. So I want to talk a little bit and go back to just thinking a little bit about resilience. We talk a little bit about resilience, and when we talk about resilience, I always want to talk about hope. The way that there's always hope. And the resilience is the ability to withstand and recover from stressors and results from a combination of intrinsic factors, things that are in ourselves, extrinsic factors, like a safe, stable, and nurturing relationships. It's all about the relationships, as you know. And as well as predisposing biological susceptibility. So quite often, like you think about a dandelion or an iris, right? The dandelion can grow anywhere. And some of us can grow anywhere. And some of us are a little bit more fragile, the orchid, little bit more fragile and need a little bit, and to understand that as well as we're looking at ourselves and building resilience in each other. And then I want to just talk really briefly, and I did it right. We've talked about, these are the things that we've had all day long, right? All these things that are strategies for well-being, parental resilience, social connections. It feels good to be back together again, doesn't it? And it's really important to notice that. We missed a lot of that when, Zoom is just not the same. Knowledge about parenting and child development. All of you out there, all you educators, understanding that and helping parents understand that, right? Concrete needs in times of support. We need housing, we need food, we need to make sure that, all of those concrete needs are met. And then social and emotional competence in ourselves and in the children that we're working with. And then these stress busters, we've talked about, these have been brought up all day, but not to forget about all of these. Not everybody needs mental health services, right? There are other things that we can do. Go out in nature, balanced nutrition. All of those things can contribute to our health and well-being and, breaking that level of stress. And one of the things that I like to think about is, we know that there's not enough therapists. We know that there's not enough professionals out there, but there's enough of us, right? There's enough of us. So together we can, we can work on doing that. So I'm going to have Barb finish it up, and we have about a minute. Sorry.
That's all right. No worries. So we just wanted to give you a little bit of a sense of what's happening around Santa Barbara County, and just to let you know that we really are kind of at the forefront of this ACEs and resilience movement. There's been a lot of work done both in the healthcare field and in the social services realm. There's a network called the Pediatric Resiliency Collaborative that is teaching physicians about ACEs, helping them to learn about trauma-informed care. And so throughout our county, we have physicians that are screening for ACEs at well child visits and teaching parents about adverse childhood experiences, helping them understand their own ACEs and how that might affect their parenting, and then trying to disrupt those cycles so that we can be making different choices. And part of the Pediatric Resiliency Collaborative is the physicians are then linked to social service navigators and mental health professionals that the families, if they have ACEs, can then have access to those resources and get linked to help. Alongside the healthcare, we have the Resilient Santa Barbara County Network that was mentioned during the introduction, and that is a cross-sector collaboration that's anchored in the Kids Network. It has folks from probation, public health, behavioral wellness, lots and lots of different community organizations, and some educators as well, and really just looking at how ACEs are affecting our community, and then what we might do to make sure that the education is out there, that these opportunities are available for kids, and that people really start to see themselves themselves as providing buffering supports. So knowing that there's lots of ACEs, knowing that there's lots of toxic stress, Veggie IQ, 100 Mile Club, you're all providing buffering supports for children and families that will help them mitigate the impacts of toxic stress. So Resilient Santa Barbara County is also linked up to the state, the PACES Connection movement, bringing all kinds of information and training opportunities for people in our community. You can access lots of that information on the PACES Connection website, and I think we gave you the list of resources in your packet. And then PERC and the Resilient Santa Barbara County came together to get a grant from the state through the ACEs Aware Initiative, and a new network of care was formed. And the exciting thing about this new network of care is that we've adopted an IT platform that will allow for seamless closed-loop referrals between healthcare and social services. So building out that network that will allow not only, I'm sending this person to you for this reason, but then that feedback back that, yes, they got the services that they asked for. And they've been very successful. We've been very successful connecting healthcare and social services. And physicians are talking. They want to be connected to schools. And so that's the next step, is to get this network of care linked up to the schools so that when you have a child in a family and you're working on these steps to success and family engagement, that physician that's treating those kids is also part of that conversation and can support whatever's happening in the school. So we're anxious to make those connections. And then finally, let me just go to the last slide here. We know that healing happens in community, and we're really excited to be invited here to talk to you about this and to be able to share the work that's happening around our county. We heard today about safe spaces, the classroom, the school, the district, the families, the communities. We're all in this together. Our biology is doing exactly what it was designed to do, and when we have that understanding, there's more compassion, there's more understanding, there's more opportunity for connection, and there's more opportunities for us to coordinate and collaborate across different sectors so that we really are supporting community well-being at every level. And so we thank you for being here, and I don't know if we have time for questions, but we're happy to take questions if you have any. Okay, we got time for questions.
Yes, so we have time for maybe 1 to 2 questions that you may want to pose to folks here. Please, this is the opportunity. This is a safe space. This is a space of learning and growing. So please, if you have any questions, now's the time to ask. Oh, y'all feeling good.
Joan has a question.
Nobody wants to quiz me on my knowledge of the brain?
Barb, I just wanted to ask you to talk about trauma-informed communities and the work of Laura Porter.
Oh, thank you. Sure, I'm happy to do that. So part of this work is really looking, taking a scan of the landscape of our county and identifying where are those places where the social determinants of health are impacting families in significant ways. And so we've identified Lompoc as a place where, we know that there are higher rates of child abuse, there's a lot of crime, there's a high rate of homelessness. There are a lot of those social issues that are linked to high ACEs in this community. And so we're able to bring some folks together from the Lompoc community with leadership from Supervisor Hartman. And Laura Porter is somebody, she's working with the Dr. Robert Anda in the ACE Interface organization. She was one of the keynote speakers at the Bridges Conference a few years ago. And so she is working with us to bring the self-healing communities model into Lompoc to see if we can do this place-based healing process with people's input that live in that community. And if we're successful there, then how can we scale that to other communities where there may be a high ACE burden? And so the model is about expanding leadership to places, to people that aren't used to being in leadership, to having a continuous learning process where we're trying things and then learning from what we're trying, to be really getting what's important to the community on the table, not what we think is important, but what the community thinks is important. And so we're really excited to be trying that out and to see where it goes. Other questions? Everybody's ready to go home. Give yourselves a pat on the back. You stayed. Thank you for listening.
Do you want to take your notes? Great. Well, thank you, Barb and Terri, for being here today, presenting and sharing the important work that you do in our community.